If any questions arise during the presentation, you can always feel free to type something into the comment section or the chat as we go along with that. There will be a Q&A at the end of this. And then this really is meant to be informational purposes only with this. Really, it's not going to replace a thorough evaluation by like a specialized therapist or someone who is a spinal specialist in this regard. But this information really should start to open your eyes as to where your other opportunities lie on this journey. So, and at the end, for those who stay to the end, there's going to be an opportunity for a raffle for a free 55-minute treatment session. So we will just wait till the end. There will also be an opportunity for someone to type in, "I'm still here." And then the drawing will happen. We'll send out the winner tomorrow. But just a heads up that that is happening. Okay, a bit about us and why we're doing this. So we open Balance Within, okay, there we go. I was on a screen glitch here. We opened Balance Within in 2015, really was to provide better solution for people overcoming low back pain, addressing missing pieces, get people back to active lifestyle, and also teach them the tools to help continue to help them living their best life with this. Big reason about it, I'm going to get a little bit more into my story, but it was my history of chronic pain and chronic body issues from over 20 years, and really having to not only continue that journey as a patient, but as a provider to kind of find that meld of helping patients, but helping myself. Because for a lot of the issues that you guys are dealing with, I can empathize with you on a lot of those fronts. I've dealt with a lot of orthopedic issues in my body. I would say I'm grateful to almost be a minor miracle, be functioning as good as I am today. But my goal, though, is to continue to look at giving this information to people and sharing this opportunity with you to actually look at these missing links. So over the past 9 years, we have well over 1,000 people come into our practice with this highly specialized type of care, improve outcomes, looking to be more of an outlier in the profession with it. And not say there's not good therapists out there. There are plenty of good therapists out there, but just as one person shared, she had 5 months of therapy and she wasn't even getting much results with it. I mean, it shouldn't take 5 months to get results or without any results with it. So there's probably something that's being missed. So we're proud of our reputation. We're proud of being able to help the people we've been able to help where other therapies may have come up short. Over 100 plus 5-star Google reviews from our patients on our ratings, and then just voted in top physical therapists of Lake Country in the past 5 years running. So for us, though, we do help people a lot of times age 40 and beyond looking for physical therapy in Delafield and beyond, looking for lasting solutions to the aches and pains naturally so they can get back to the life that they want without unnecessary medications or surgeries. Who is this masterclass for? Well, this is a lot of people. You guys shared your stories tonight. Thank you. This class isn't just for limiting low back pain, sciatica, though. Ultimately, though, this is for someone who's really looking to get to the root cause of their problem. Really, not just because everyone says, I want to feel better, but there's a why behind it. Why? I want to hike on trail with friends. I want to get on and off the floor with the grandkids. I want to get in the garden. I want to stay on the pickleball court. I want to bike ride. So I want to be able to just sit comfortably, whether it be at work or at a show, and just have confidence that my body is going to hold up for me as I continue to age and still take part in life, rather than worrying about what's my life going to be in the next 5, 10, 15, 20 years from now. So if this sounds like you, though, you have low back pain that shoots down your leg, you were told you have arthritis, degenerative disc disease, which is not a disease, we'll get into that in a moment, herniated discs, spondylolisthesis, stenosis, feel you might have tried everything, whether it be chiropractic, physical therapy, massage, acupuncture, meds, injection, surgery, and you're still hurting, or if you just want to be more active and you can't due to the pain and you're afraid of it making it worse afterwards, or if you're just going to be told you're going to have to live with the pain. I had heard that multiple times on my journey. That is one of my most frustrating things that I will hear from someone who's come from a specialist saying you're just going to have to live with the pain. I think that is one of the most defeating things to say to a patient. I've had to experience that as a patient, and it just fries me every time I hear that. What you will learn tonight, so what really causes low back pain and why you might be looking at it incorrectly. Missing links that can be driving the back pain, driving you crazy, problems with imaging, and problems with some of the solutions that exist, and actually some of the options that you can do to start taking care of your back pain starting now. So about me, again, I'm Dr. Jereme Trunk, Doctor of Physical Therapy for over 20 years, orthopedic and spinal specialist, advanced John Barnes myofascial release specialist, recovered chronic back pain suffering from over 20 years, co-owner, founder Balance Within Integrative Physical Therapy with my lovely wife, Dr. Sarah. And then father, husband, hiker, biker, and musician. So my story, so as I mentioned a little bit about my background with this, and so I've had, this is probably the main one, but I can tell a lot of other stories of traumas of just abusing my body and life at a young age, or just having some random things happen to me that shouldn't happen to everyone. Like just riding your bike down the street and literally the bike just collapsed and just tumbled. Like literally the bike frame broke. And I probably weighed 50, 60 pounds. Yeah, crazy. But ski accident, age 14, poor conditions, poor skill level, broke my collarbone and displaced 3 different levels of my vertebrae of my spine. But the problem with that was that I went to a number of specialists at the time. I was told, you just sprained your back. You're going to have to work through the pain. You're young. You don't have pain going down the leg at this point. You don't have any neurologic issues with it. So just keep doing what you're doing. You're young. You'll be fine. So I tried PT, massage, acupuncture. I went to a pain specialist / pain clinic, chiropractic, meds, x-rays, MRIs, had it all. Like I said, I can empathize with a lot of you guys on this journey. So temporary relief, small relief. Not to say that things didn't help at times, but it was not enough to break free from the pain. I was told by multiple providers, as I told you, this is my pet peeve. You're just going to have to live with the pain. And then I was worried about my ability to do my job as a PT in the long run, thinking a couple of years into profession, like if I'm hurting this much now, like how am I going to be able to do my job even a few years from now? What's my life going to be like in just X number of years? I lived taking daily ibuprofen. I would get the large Costco bottles and just pop a couple ibuprofen each day. Developed terrible acid reflux with that. I haven't taken an antacid in over 10 years. I'm so grateful for that. I know there could be other things than that, but those NSAIDs can just ravage your GI system. It hurt to take deep breaths for many years. And so I would oftentimes breathe very shallowly. We're going to learn about why that's a problem. And that was the years I was a runner as well. So big thing for me though, I started to unlock my body with myofascial release, allowed me to get out of that straitjacket of tension of my body and realize tension so I could restabilize my body. Because oftentimes I would try to get stronger, but every time I tried to get stronger, I would keep running into the roadblock that would keep hurting. Very random event with that, though. When I started doing the myofascial release, I ended up going from 6'2" to 6'4" in my 30s. That is not something I can guarantee that can put 2 inches back into your spine, but that is the power that in some of these types of techniques of being able to get your spine to be able to decompress. You may have actually more space left in there than you think. But now I live an active life, pain-free day to day. No meds, continue to be a PT, and all these other wonderful things. Hiker, biker, musician, father, husband, 18 years and counting. But I continue to take care of myself. I continue to live an active lifestyle to stay on top of it. I'm lucky one, truly, I'm incredibly lucky to be where I'm at in this life. So I do say I'm like a fine bottle of wine or like just a unicorn in the sense that as I get older in life, I do feel better in my body. I do feel better in my 40s and in my 20s in my body. So from that standpoint, though, what I like to say is we all have the capacity to improve and feel good in our body, no matter how long the problem has been there. And so again, what I want to do tonight is I want to share with you some of these key missing links that not only help me, but also help a lot of our patients who have dealt with a lot of these tricky and stubborn problems to overcome their back pain. So let's jump into it, guys. Karen, that probably looks like your cat and mine too, but the same spotting pattern. Low back pain. In the sense of the medical system, guys, low back pain is a huge problem. It's a huge problem. And so the stats behind this, second most common reason to a doctor's visit, 4 to 5 people suffering debilitating back pain episode at some point in their life. So 80% of us. People aged 45 to 64 usually report the highest rates of low back pain. And then usually right now it's estimated, and actually this estimate probably was from a couple years ago, so I would expect this to be a bit larger right now, but $100 billion on low back pain treatments in the US per year in the past few years. And so it is typically the number one reason people seek us out for our guidance at our practice, and the number one specialty at our practice really is low back and spinal problems. Because really, if the body isn't working well, it all comes back to our core and our spine. So what causes back pain? There could be a multitude of factors, but here's some of our usual suspects with this. Sitting all day. Like in our entire evolutionary process as human beings, we sit more now than we ever have throughout the course of our humanity evolution. And so oftentimes our body starts to get used to the position called chair. So we get really tight in the front side. We start to kind of get maybe like forward flex or rounded shoulders. We get tightnesses in our low back or in our legs. Like it's sitting all day, like it's not our best friend. Sometimes it's the wrong type of exercise. Sometimes some of the exercises people say they're doing, like there are types of exercise that I recommend. They're doing Pilates, they're doing yoga. And at times those can be incredible tools to help stay on top of back pain or even help treat it. But if it's not working, sometimes there's just a few steps, maybe just a few underneath that actually can still get you back into that game and knowing how to use your body much more effectively. That makes those exercises and those types of therapy work much better for you. Postural changes, I mentioned that with the sitting, but these all ultimately add up to one big problem: imbalances, and more some mechanical imbalances. We're going to get into that in a moment here. So these imbalances will affect muscles, joints, nerves, the fascia, which is the connective tissue of the body alignment. Top 4 common causes. I know sometimes we all have maybe like some slightly different ones that are kind of more specific to us, but a lot of times these factors have a lot of similar underlying usual suspects, but these are usually some of the top 4. I could maybe say top 5, but I did kind of group stenosis in with degenerative disc. They're very similar. They're not always exclusive to each other, but they're so similar. So SI joint dysfunction, sciatica, just muscular low back pain, and then degenerative disc and stenosis. So SI joint dysfunction. So right here, I don't know if you can see my cursor here, but this slide kind of highlights where the SI joint is. It is where our pelvis meets our sacrum, which is the triangle bone that sits between there and where our tailbone attaches to. Typically, SI joint pain kind of presents as typically like low back pain or butt pain or the backside of our hip. It's usually one-sided. It might be worse with standing or climbing stairs or transitions like going from sit to stand or maybe standing on one leg. The pain sometimes with this can radiate into the thigh. You can still sometimes get some of that nerve component with this, but it's usually not past the knee. And a big part of this oftentimes is a pelvic alignment problem as well. So if we have our pelvis and our sacrum here, but if we start shifting this around, that is going to add a lot of compression into those joints. A lot of people I've seen before in the past and help, they say, I've gotten SI joint injections. And sometimes some people say it's given some relief, but ultimately I would say 100% the ones that I've seen, that pain has come back because ultimately it is a bandage fix. But oftentimes if someone's saying I have SI joint pain, this is what you are looking at. Sciatica. With sciatica, so the nerve can get pinched either in the low back or in the glute/piriformis region, which is basically kind of like the muscles of the hip. So sometimes you can maybe get a little bit of both, where you might be getting a little compression in the low back and some of those tightnesses in the muscles, and we need to treat both of them. So sometimes people might be saying, like, some people have heard the term piriformis syndrome, or they just say, like, I have a pinched nerve in my back, or like, where's this coming from? Sometimes we just got to treat both of them. Or sometimes we'll see that pelvic misalignment, it might be shoved up higher on one side, and that's compressing everything in that low back on that one side, especially those nerves. So typically that presents with sharp burning or almost like that electric pain going down one leg with that. And it usually goes down one leg. It's not usually both with this one. Struggling to stand up straight, numbness, tingling. Sometimes you might get some weakness in the muscle with that, or depending on if a doctor has checked your reflexes, you might see a diminished reflex response with that. Sometimes activities you might see sitting, coughing, sneezing, or bending forward makes this worse. So muscular low back pain. So this is where kind of just like sometimes like people will talk about just like, hey, I got this pain across my low back. It's kind of just like this achiness with this. And so not to say that there can't be alignment issues from those previous slides, but a lot of times these tight muscles are a big part of where these core muscles are maybe too weak. And then we have these larger muscles in our body that have to work overtime with that. And then over time, those muscles get irritated, they get tired, they start getting a little upset, they start raising a hand saying, hey, you got to pay attention to me here. I need a little bit of work here. So often you can find some overlap with some of these, but typically muscular back pain though presents more so just like with that achiness in the back. And we have a lot of muscle imbalances with that. Degenerative disc disease. And disease is in quotations. It is not truly a disease. You're not going to catch it by sitting next to your spouse or sneezing on someone. You're not catching a disease. They call it disease because it limits your life. I had to look into that. I was like, truly, like, just the curiosity was just getting me, like, for why do they call this disease? But they just say disease was anything that impacts your quality of life was the main reason why they call it a disease. But oftentimes, though, that disease is more so the fact that we're not having great support on our spine. Our discs are getting overwhelmed. And sometimes with age, we do lose some of that disc height. But however, though, there's a lot of factors that we can control of taking pressure off those discs. But when they start to narrow and they start to lose that disc height with it, that's when we can start to get some of those spinal nerve compressions with that. So sometimes that sciatica type stuff can present still from this, or the stenosis, where we get the narrowing. It's the narrowing of the spaces where those nerves exit the spine, but that narrowing oftentimes is coming from those discs starting to degenerate. There's some other positioning stuff, which I'm going to get to in a couple slides though, but that is also a big driver of that stenosis piece of it. But usually with this pain, it's more kind of deep in the low back. Sometimes I might refer to the hip or thigh region with it. It usually tends to be a little more chronic with worse with sitting, bending, lifting. And then sometimes you can have some really intense episodes of pain just right in the center of the low back. These are some intense episodes when we see some of this really misbehaving. Good news. The good news with this. So I just laid out all of these diagnoses. I just laid out all of these different kind of usual suspect drivers with this. But here's the thing, mechanically speaking, meaning our alignment, our muscles, our stability, these are the things that oftentimes lead to these things presenting and happening. Because typically, unless it's maybe some sort of genetic component, there can be, but genetics actually play a much lesser percentage of actual play into our problems in our body. Not to say that it can't do that, but research-wise, it's been estimated sometimes that genetics can be as low as maybe 10% of our problems in our back. And maybe sometimes I've seen maybe up to 25 to 30%. But regardless, the majority of it is mechanical. These are the things that you can address, guys. So these are the things that looking at the muscles, the stability, the alignment, how you're using your body can so greatly improve this and actually make a large impact, even if you've had surgery or been told you need surgery with this. So that is really the good news, that based even on research, that there is an actual huge opportunity to take care of this. But however, with Western medicine, we'll get into that too. Western medicine wants you to kind of go for that quick fix or go for the bandage fix with it. But getting to the root of the issue, with this. And so this is how we would look at someone working in our practice in terms of looking at taking them from day one to day whatever, in terms of each one has their own different timeline with that, but it's usually kind of going into these types of progressions with it, guys. So step one is we want to get you out of pain. We want to get the quick wins. We want to find what's really tight, what is spasming, what can we do for releasing that tension on those structures that are just not behaving, and angry and raising a hand and saying, hey, you better pay attention to me. We're looking at it with myofascial release or dry needling or cupping or pelvic rebalancing. And once we start getting into addressing the root causes of it, there is overlap between the two. But if we're looking at a tiered approach with it, then we're looking at restoring symmetry, restoring stability, and that's getting into the core. I'm going to teach you today too, getting into the core is maybe not necessarily all that you completely know from your past experiences with this. And so then once we start getting you stronger in your core, we want to strengthen into functional movements. We need to be able to take that ability, hey, you can do this exercise on the table. Let's get you on your feet. Let's get you used to being able to use these muscles properly together. Let's get you lifting things, because in our life, we're going to have to lift things. We're going to have to support our body with our feet underneath us. So we do want to strengthen into functional movements with it. At times, you can find individuals who've had therapy, who have had some good exercises done, and you get into the functional stuff, hey, can you lift this? Well, no, I can't really lift this without pain. Well, we maybe got to step 2, but we didn't even get to step 3. with that. And so what we always like to say is we want to build out your toolkit so that you have tools for life. Guys, we're not reinventing any wheels here with this. This is looking at for you how to take care of not only some of the usual suspects, but you learning how your body's specific imbalances are playing out so that if you fluctuate, because life's going to happen, how can you help restore that alignment or take out that tension? Like, hey, I did a road trip and I got out of the car and boy, my back was starting to really ache. Or I worked out in the yard for 8 hours a day for each day this weekend. Life can happen, but having those tools that you can bring that back down and be able to get things restored so that you can get back to work on Monday is worth its weight in gold. And then ultimately building a solid game plan together just to keep you feeling better long-term. And what we're looking at is doing whether it be a home program, Pilates, yoga, gym, doing some stuff at the gym or workout classes. And a lot of times we see people coming in already doing these things. They're already doing a lot of the right stuff. But as I said, we might have missed a couple of step 1, step 2, or maybe step 3 to have that long-term actually work well for you with it. So that is our goal, to get to those other steps that may have been missed by other therapies or was just not knowledge known. So for some of those missing pieces, these are some of the next few slides here, guys. This is where I'm going to be looking at some of the hidden factors that can really be a pistol in a lot of individuals that have never been addressed with their back pain. And so the fascial system, the connective tissue system that connects us all. And so it is kind of like a cobweb that exists all throughout our body, literally head to toe. Some studies say it connects to every cell. Some say it connects to just kind of groupings of muscle fibers. Either way, it is the one connector of everything in our body. Tricky part about this is it can exert high levels of force. At its most, it's been clinically shown in the lab to produce up to 2,000 pounds per square inch of compression, which is insane. That's almost a metric ton of pressure in just a small square that system can produce without truly like shutting down the body. That is a worst case scenario, but regardless though, a very high force producing system. It can be almost like a straitjacket on the body if you have a lot of that compression on there. And it usually happens in response to traumas, whether it be small traumas, which are like repetitive sitting in a certain position, poor movement patterns, large traumas such as injuries or accidents. And it does not show up on traditional imaging. This is the kicker, guys. X-rays, MRIs, CT scans does not show this. They do have some ultrasounds developed in Europe. Europe is usually one step ahead of us when it comes to this type of stuff, of imaging and medical practices in general. Europe already has some ultrasounds that can show fascial restrictions and trying to give some quantification of it. But regardless, though, you can oftentimes feel that tight tension with it. Cool part about working at this system, though, is that it does not necessarily have to be a super aggressive, super painful type of an approach for it to actually produce some results. Oftentimes when we're working with someone with this, if we're really truly getting into the fascial system, we might just hold something just mild to moderate pressure and just hold it for a few minutes, and you start to just feel some slow opening happen to get some of those deeper releases. But you can see in the photos on this right here that system, there's an actual dissection photo right there. You can see the fascial system within a dissection, and there's a model of how that would impact different layers going to the skin and to the muscle with that cobwebbing. So and this is just an example of how that fascial system really does impact our whole body. There has been some research done on different systems, different fascial, they sometimes say slings or different fascial planes where they kind of have more connectivity, where sometimes if someone has a headache, we might be working not only at the head, but working into the abdominal area, working into the thigh region to really make sure we're looking at this as a full body picture with it. And as you can see on that one photo all the way on the right, it's like a snag in the system of like a sweater. If you start pulling on that, you might have tightness in one spot, but that tightness will start to pull into multiple other areas of the body. Getting into the core. Oh man, like this is where I almost want to turn off the slide presentation to see a show of hands with this. But be honest with this guy, just for the sake of replay with this. But what kind of core do you want? Show of hands. Who wants the washboard abs? So just who thinks we need the washboard abs? With it, just put your hand up. Washboard abs, strong core. Who wants the can of Coke? I don't know. Question is though, what kind of core do you need? Okay, so a lot of times people look at core as just the abdominals on the front, the ones that you can see. But truly, if we break down our core, it comes down to almost a canister shape. You need a system that can support your body 360 degrees with support on the top and on the bottom. And when you have that, that's when you can build all of your body around that. So this picture right here, I love this photo. There was a lab test that was done that equally loaded, so it just with symmetrical weight on there, loaded a sealed pop can with it. It can take up to 700 pounds of force before it changes shape. So by design, a solid canister is an incredibly strong structure by design in nature. So what makes our core? If we break it down into its three most fundamental and primary components, we are looking at this deep core of three pieces: your diaphragm, which is your primary breathing muscle, your transverse abdominis, which is the deepest of all our abdominals. It goes all the way around like a corset or a girdle, and then the muscles of the pelvic floor. So with that, other muscles can also help support our core, help support our spine, such as the obliques or the rectus, which is our six-pack muscle. But if that canister is not doing its job, all those muscles will have to work more, and that's going to create tension imbalances in the body. And so that was like from that previous slide of that muscular pain in the low back, where those larger muscles do tend to start working overtime. And then what we do find is that we have to get to that deep core. We need to get this. This is your post. This is your anchoring into the body, or that post in the ground that everything needs to anchor into with that. And a lot of times people may be coming in doing these higher level exercises, working the bigger muscles, but all these lesser ones are oftentimes missed, or just they're working so hard that these muscles don't even get a chance to kick in with that. So what does that mean? Well, forever put the show of hands, washboard abs does not mean you have a strong core. You have strength in your body. You have you got some great perseverance in terms of staying disciplined enough to eat a good diet and go to the gym enough to get six-pack abs. Six-pack abs does not mean you will have no low back pain. So if you cannot stabilize the canister, you can and will overstress your spine, the discs, the nerves, and potentially other aspects of your body, meaning all your other joints. So for example, I'm just going to talk about this one right here real quick about for the female population. Males can be affected by this too, but especially females who have, God bless you, given birth to a child with this. Your pelvic floor, sometimes some people have had pelvic floor therapy with it, but that aspect of that pelvic floor being the bottom part of your core, they might have come in and say like, hey, I had pelvic floor therapy, but I still have pain. And they didn't look at the diaphragm. They didn't look at the transverse abdominis. And over time, those females, they're statistically a more prevalent presentation of females needing more joint replacements in this world. And so this is one of the reasons why they say that that's probably one of the top drivers with it, is due to that pelvic floor being the bottom part of the core, not fully being reset. And you are overstraining your joints more with that. So like I said, guys are not immune to it, but females do have a higher prevalence. So how you breathe and how you line your body will greatly impact your spine and the rest of your body. On that picture, A and B, A is a nice properly balanced one where we get more of a parallel alignment between that rib cage or that diaphragm and your pelvic floor. And B this is for the people. These are for for all you guys out there who have had the pinched nerves in your back, who have had spondylolisthesis, degenerative disc disease. This type of an alignment here is oftentimes one of the common ones with it that can often be found that is overstressing a lot with it. And the picture tries to show that the muscles and that redness in there is really compressing more of those discs. You can kind of see that happen. They try to have that visual presentation of it. But that type of presentation, that is one of the key contributing factors to some of those pathologies we were talking about earlier in those slides. So you're breathing wrong and it's hurting your spine, your neck, your joints, your digestion, and even increasing your stress. Your diaphragm is your primary breathing muscle, but it is also one of your primary core stabilizers. And if that is not doing its job, you cannot even stabilize your core effectively with that. You could do all the abdominal bracing in the world, you'll get some support, but until we start getting this into play, you are going to still be missing pieces. Not only pieces, key foundational pieces with that. So the body alignment and posture greatly impacts the diaphragm's ability to work properly. And this goes back into more of an alignment standpoint of trying to take enough tension out of the body and give it enough strength and enough awareness that you guys are stacking your body properly so that when you're using it, you are setting yourself up for proper support, whatever activity you are doing. And the foundation to your body, this guy right here, he's not too happy. He's got a crack in his foundation. He's got shoulders that are on level. He's got one leg longer than the other, and he is just feeling it. And so he has a problem with his pelvis. And so with that right there, a level and stable foundation will allow the rest of the body to work better together. And just like a home, I do love this analogy. If we're using our home as the analogy, if the foundation is flat, level, and stable, everything works better together. But if that foundation shifts, guys, you're going to see what? You're going to see potentially cracks in the walls. You're going to see windows are getting sticky. Maybe doors are getting sticky. But we're not saying we have a wall, window, and a door problem with it. At the root of it, we still have a foundation problem. And research shows that anywhere up to 90% of people with pain anywhere in the body will have an uneven pelvis. So it's been as low as 50% to some studies, up to 90%. For what we see in the clinic, I would argue it's probably very much on that 90% mark with that. And then some of these other ones in here, guys, some of these you probably have already come across. I know one of you guys mentioned your hip. Hip strength and motion is a big piece of it, but usual suspects, I put some of the ones at the top here that tend to be missed on a lot of individuals. So that fascial system that can produce 2,000 pounds of square inch of pressure, potentially your pelvic alignments, problems with your breathing and your pressure management of that cylinder, the deep core stabilization muscles, that is that canister, but they're not firing properly. So poor movement patterns, body mechanics, we're just not really doing healthy movements during the day, and there's that repetitive stress that's breaking things down over time. And other pieces as well, we always want to look at making sure that we're not missing anything. So we're going to be looking at your upper spine with that, your ankles, your hips, your posture, your tight hip flexors. Probably a lot of you guys have probably dealt with some tight hip flexors if you've had any sort of therapy. Pelvic floor tension, potentially improper foot support, but there could be more with that, but those are the big ones, guys. And so for the ones who have had therapies or treatments that have not worked, but if you had, especially from the ones who've had therapy, and you maybe have just gone straight into just straight core stability, we all need it. But however, though, how we get into it and how those foundational pieces are laid can truly impact the difference between success or still spinning your wheels with where you're at. All our pieces do need to work together for optimal spinal health. Oftentimes, just a couple of these can make a big win in the body. But if we're seeing some tricky ones, we want to start looking at them. But we want to look at the body as one whole functional unit. We don't want to be what the Western medical system has kind of come to at this point. Everyone gets treated in silos. I have a neck problem. Okay, here's your neck specialist. I have a hip problem. Here's your hip specialist. I have a back specialist. Is that the same as the hip? Well, they're intercorrelated quite a bit, but nope, that's a different one. So from that standpoint of like, why does modern medicine working and looking at the body working in isolation from each other, take that approach with it? So we want to look at all those pieces working together. And as I kind of mentioned this too, here's the kicker. Like a lot of times people come in with low back pain.
Pee-pee. Hi, Charlie. Come, honey. Oh, I'm sorry. Can you hear me?
If you could just mute your video with that, that'd be
gosh,
great.
I'm so sorry.
That's okay. I probably thought you just saw the video, and then you probably just thought that dog was being poor baby getting just roundhouse to the face with that. I honestly thought that was the initial response.
Oh my God.
So, anyways, guys, a lot of times people will come in and you have low back pain, but almost always it's not also the other problems going on in the body. It may be the main problem, but at the same time, there are other things going on. So this is why we say we like to look at the body as one whole unit with this, and not just saying like, hey, here's your hip, here's your shoulder. You do need to look directly at those areas, but we do want to make sure how the whole body is working together with that. Sometimes people will ask what came first, and I just say it doesn't matter. So whether we're looking at the foundations of your body, if we're looking at addressing in isolation and you're getting short-lasting results and you're not getting back to your full life, but if you're addressing it as a body rather than a random set of isolated problems, it can help provide much better long-term relief, not only for your back pain, but from a lot of the other pains that were also going on in your body at that time as well. Yes, we're going to be looking for the quick wins. We're looking for really making sure that where are the opportunities that are going to make the quickest impact on the front end with it, and make sure that we can get you feeling better as quickly as possible with it. But for the long run with it, what came first, it doesn't usually matter a ton. It doesn't matter a ton. I just think we just need to look at it all together with that. Common questions have oftentimes that come in: should I get imaging done? Have I tried everything? Will surgery fix this? Maybe I need some painkillers or an injection. And this is all something this is a true story. I was like, I one time saw dog food that said, how do we know that a new dog food has an improved taste? Who is actually tasting this stuff to truly know, does it taste better? And do they actually have any sort of real feedback on that? So imaging, it is not, imaging, I think, should always be taken with a grain of salt, and we're going to get into that slide in just a moment here. But at the same time, the cost of it too, average cost of an x-ray, $100 to $1,000. Average cost of an MRI, $400 to $5,700. And this is where I have a slide coming up. 60 to 70% of adults with no symptoms have abnormal findings on their imaging. This includes back, knee, shoulder, neck. So we are not always just our label with it. And even in the medical world, there is kind of like the little kind of tongue-in-cheek thing that MRI stands for might reveal injury with it. So what shows on imaging might not be where the pain is, but it may not be what's causing it. This is where we talk about those mechanical factors with that. Because options after imaging are usually meds, injection, surgery, or therapy. And oftentimes if someone's getting imaging done, therapy will be recommended anyways with it. So sometimes someone comes in asking, should I get imaging done? My response is go after the root cause. And if it's still being funky with it, get the imaging done then. But if you get the imaging done already on the front end with it, not saying it's not helpful to know what's going on in there or rule out anything major. But oftentimes though, it may just be just like, here's what you have. We can offer you meds or an injection, or just do therapy with it. So oftentimes we just find just by doing therapy, that can be just as good without having to do the imaging with it. However, though, there is the right time and place. So please don't take it that way that we're against imaging at all. But here is one of the, here is a photo from a journal article in terms of looking at people getting imaging on their back with no symptoms in their back. Okay, so age in their 20s up to the age 80s with it. And so as you can see, of course, as we get older, those percentages increase. Yes, that does happen. Yes, there could be some age-related stuff as well with it. But however, though, these are asymptomatic people. These are people with no pain. These are people with no major problems in their spine, but yet when they're getting imaging on there, they're showing disc degeneration. They're showing disc bulges, disc protrusions. They're showing spondylolisthesis. Spondies can still hurt, but regardless, though, it's not always necessarily the main cause of the pain itself. These are the mechanical things. These are what we're looking at, guys. This is what we come in here to try to give you that opportunity to find out from us. What can we say is there opportunities with this from a mechanical standpoint, or just with some questions and some evaluation, we might be able to already tease out and say, you know, this is not mechanical versus maybe you do need to get that imaging done. Doesn't happen often, but it does happen. But oftentimes, this is where we say the opportunity is you can still make sure that you're addressing mechanical pieces of this, and you can still make a huge impact in the body because we are not just our results of our imaging with that. So the medications and injections and surgery, oh my, there's a time and place for all of them. There is a time and place for that. Thank God for modern medicine in a number of times, truly, like to be able to get pain under control, or truly in the time of situation, if there really is a surgery that's needed, we got some blessings of being in the world that we live in right now with that. However, though, we're talking about the shortcomings right now. So if we're looking at these, we're looking at even from a cost standpoint, average cost of each spinal injection is $4,000. Average cost of a spinal fusion in Milwaukee, this was, like I said, these numbers were pulled from a couple years ago. It was $70,000 at the time. I'm sure that number has gone up. And this is, I mean, this right here, the rate of success for a spinal surgery, statistically speaking, this is not hidden information. It's 50% at best. And so you can still get the surgery. Sometimes people will get it a little bit better. Sometimes some people get it lots better. Great. Sometimes some people get it and nothing's better. Crap. And so in that regards, these approaches are oftentimes, like when I look at these injections and medication, they can be bandage approaches, and it still can be a matter of time before the pain returns. And surgery probably is only one piece rather than just calling it a bandage it is something that probably would took care of one piece of it, but there were still a few other pieces beyond that. Coming down to the end here, guys. Thanks for sticking with me. Just last couple slides here. But another way to look at it, so I was talking about this mechanical piece, talking about alignment. If you're driving your car, your axles are out of alignment. If you keep driving that way, you're going to put more pressure on one tire or a couple tires, and you might get a blowout. If you change that tire, did you fix the root of the problem? You can get on the road, you can drive, and you can get back out there. Great. But it's going to be a matter of time before we start to see some of those areas start to talk up a little bit more again, because we are still looking at it from the standpoint of we did a bandage approach on it rather than getting to realigning, getting to the root of the problem with it. So if we're only treating where it hurts or what's only seen on an image, really are we getting to the root of the problem? So in summary, source of the back pain is not always just where you hurt. The majority of back pain is mechanical. And again, that's the good news, guys. This is where you have the opportunity based on your history, based on your diagnosis, based on your surgical history, or even if you've just been told you need a surgery. The good part is oftentimes it is a mechanical driver of these problems, and these mechanical factors are the ones that we can address. So the multiple factors that can contribute to low back pain, and every person's body is a little bit different, but we always want to make sure that we're looking at where someone has those easy wins, where some of the alignment issues or breathing or core. We always tease out, it's not cookie cutter in terms of looking and say, here's the sheet, so just do these exercises. So we always want to make sure they let you know that we're here for you guys to, whether you choose to work with us or not with it. So for us, honestly, like I've been doing this for 20 years, and then we've been having the practice open. It'll be 10 years this year as well. And so in regards to that, we know that sometimes some people may not be the best fit for our practice for where their needs are at, whether it be finances, whether it be their health, whether it be their medical background, whether it be what they need for just any other specialty with it. And we always are willing to refer out to whatever is the best fit. Honestly, we just want to help you with this, guys. The information tonight is here to help you with it. So there is no pressure on anything with this moving forward. But we'll get into just the options of working with us. But a couple quick things to get into right now, just a couple key exercises that you can do to start already feeling better now. So I do, for all you guys who are on here tonight, you will be getting these emailed over to you. So don't worry if you're trying to look at this right now, trying to remember what's on there, trying to do it and say, what did he say? You're going to get this email to you. But either way, I'm going to go through just a couple of ones right here that are sometimes some of the big wins that we can find right off the bat. For the breathing ones, I put seated, standing, and an exercise with the belt. Whether you're sitting, standing, or laying down, we're going to be looking at getting that diaphragm moving. So don't look at it as necessarily of having to do all these different ones. It is just being able to breathe properly in different positions with that, okay? So for this one right here, this is a great exercise to be able to just see how you are breathing. I'm going to take a quick pause here real quick. I want everyone give themselves a little bit of a hug here. I want you to put your hands on top of your shoulders here, more so like, top of the shoulders here. Give yourself a hug, give yourself some love for first and foremost. And then two, once you're in that position, take a couple deep breaths. So the only cue I'm just going to give you is just take some real deep breaths and just do what feels natural to you. So just take a moment there. Since I can't see you, I'm just going to keep talking here, but I'm going to be talking about as we're breathing, are we seeing or feeling these hands go for a ride? Are they coming up and down? Or are they staying kind of quiet with it? Most people are probably going to be moving up and down, and I'm going to tell you guys that's not what you want, okay? This is a real quick check to see, are we actually using our diaphragm, which is coming from our midsection. We can call it belly, but we're actually looking for a 360-degree opening between the front side of our ribs, the lateral side, so the outers, and then the back side with it. When we use our diaphragm, it's almost kind of like opening up an umbrella. It really is kind of just opening up 360 degrees. So this exercise here is more so a feedback exercise to see how you're breathing. You can take a belt or a sheet or a resistance band and put it around there. It's not for resistance. It is just to see when you take a breath, is that belt moving? If it's not, you're not using your diaphragm. And so some people maybe get a little bit of movement. Some people maybe just get a little bit of movement in the front, but we're trying to get 360, because if you can't breathe into an area in your body, you cannot stabilize into it either. This is what we're talking about, getting into that deep core stability, guys. This is the times where we oftentimes see people with this chronic low back pain. You tell them to take a breath, and they've been doing all the core stability exercises for years, and their shoulders are just doing all the work. I was caught in that for years. That's where earlier in the slides where I said for my spinal injury, it hurt to take a deep breath. I chose to then breathe very shallowly, allow my neck to find muscles other than just being thin. This is still a lot of years of these muscles working overtime on me. This is not just saying like, hey, I just worked out a lot and got great muscle definition, but it used to be a lot more with that. But man, over time, that takes its toll. Headaches, neck pain, jaw pain. So this breathing stuff right here, we know that we're talking about from a low back standpoint, this can drive a lot of stuff in the neck and in the head. So when you inhale, try and do it in through the nose for 5 seconds, and exhale for 5 seconds. Inhale for 5 seconds, and exhale for 5 seconds. 5 is not a random number. 5 is what is based on all science and research. That is considered the ideal breathing cadence for the human body is 5 seconds in, 5 seconds out. On average, they say the human population is doing it about 3 or under. Looking at it this way here, this person has their hand on the chest and on the belly. This is just another, I just put this in there so people can have another variant to be able to get some checkpoints with it. It's okay if the chest moves a little bit. Again, I'm going to pick on more with the shoulders with it. But if someone is still only using the upper body, you're going to feel just the chest move and nothing in that belly or in that lower diaphragm area. So this is an opportunity for you to be able to just start getting awareness as to how you are breathing. I had a couple of patients recently too that this stands out. Honestly, I've seen them both in the past week. One was a spinal fusion. I saw her before her surgery, a couple sessions, but it had progressed to quite a ways. And after surgery, she could not take some of the medications with it just due to some body's responses to it. But before surgery, I said, after surgery, here's what I want you to do. You're not gonna be able to do much. You're gonna be on your precautions. I just want you to sit and practice the breathing. And we went over the breathing a couple sessions with it, just reviewed it while we were doing some of the hands-on work as well. She came back after surgery and she said, the only one thing post-operative that actually made a difference to me was doing the breathing exercises. It was the only pain management truly that she was able to use post-op. So I give her mad props for being post-op spinal replacement and just using her breathing to manage her pain. It's amazing, guys. And then even at a gentleman who saw him a couple of years ago, breathing was one of the first things we went over with him. He had been doing good for a number of months and then had a flare-up, but he said that when his flare-up happened, the one thing that made the biggest difference was going back to his breathing exercises. So where I'm going with this is don't let the simplicity of this fool you. Don't let it just say, okay, it's just teaching me breathing. It is more than just breathing. This is our deep core. This is our deep spinal stabilizers. This is our foundation. Postural checkpoints here. This is where I was mentioning in the previous slides about how we stack our body is going to make a big difference with and how that diaphragm moves. This can be different for everybody. There are different postures, but there are some usual suspects, such as the rounded shoulders, maybe the forward head. Sometimes you can see maybe in photo 1 there, she's got maybe a little bit more of her pelvis tilted forward. That's a little bit harder for you guys to see with that, but those are the types of things that we oftentimes will try and get people to stack up. Get the head in line with the shoulders in line with the hips. So get those hips underneath you. You'd be surprised if you stand sideways in a mirror and look to the side, those hips are not standing underneath you. They oftentimes are usually tilted to the front or shifted to the front with that. So just getting those body points just lined up with that. Sometimes even just teaching someone to get in that position, breathe, and then, hey, you know that thing you're having trouble picking up, whether it be the groceries, your grandchild, just try that right off the bat. And most of the time, you can already feel an immediate difference with that. How we stack our body and how we position it makes a huge impact. This one right here, I love this one just because it's probably one of the biggest bang for your buck stretches in the human body. As we get caught with most of our sitting positions throughout the day, we don't use much of our arms overhead, but this also impacts the spine as well. This is also considered a spinal stretch and shoulder stretch and neck stretch, sometimes hamstring stretch and calf stretch. There's a lot. So standing up at a counter, hands up on there, just dipping the body down so you feel that stretch there. I would say if you have the capacity to do it, hold it for a minimum of 2 minutes. Quick holds, 30 seconds. 30 seconds don't usually get as quick or as deep of a release, but they're still good for quick releases, guys. So not everything always has to be multiple minutes, but I put the minutes one in there because that's the one that's a different approach for most people. It's holding it long enough for the tissue to actually respond to that positioning. And then this is the other chair position. For some of you guys, this may not be appropriate, and we would look to do some modifications of it, but those hip flexors, those are the muscles that are in the front side of our pelvis. They attach to our lumbar spine, our pelvis, and our femur, which is our thigh bone. They are big impact players for a lot of issues, whether it be hip, back, even upper back issues as well can sometimes stem from these guys. So this one in here, that kneeling stretch where you're on the ground, I do recommend that you do have something to hold on to so you can balance with it. Leaning forward till you feel a gentle stretch in the thigh or maybe in that lower pelvic region. Same thing, hold for minimum 2 minutes. If you want to do a quick stretch, 30 seconds. And then this is the other one right here, the hip rotator stretch. A lot of times we get a lot of people with tight ones with this, but this one right here, cross the leg over in the chair. You're leaning forward till you feel a nice stretch in that back side with it. Some people don't even have to lean very far forward. It's almost kind of just sitting upright, and they are already feeling things tugging. They are that tight. So again, these exercises will be emailed to you guys for some quick starting spots with it. Some of you may have done these exercises before, but just so you can have this reference and this information. 4 more tips here. Breathe through your nose as much as possible. This is another simplistic one that makes a huge impact. There is a huge amount of research of the difference between breathing through your nose and breathing through your mouth. So from the standpoint of just breathing through your nose, I'm put it in bold. I'm coming at it from the standpoint of it's making that diaphragm work more, but it increases immunity, circulation in the body, decreases allergies, decreases risk of sleep apnea, and there's a whole other multitude of ones, but I try to just pick on some of the big ones. Hot or cold, I do have a number of people who have this question a lot of times. I am usually a proponent of heat with it. I think Western medicine overuses ice immensely with it. And the reason is that when we have areas of chronic tension in the body, we oftentimes get poor circulation to there. So heat on there opens things up, opens up that circulation. So shower test, if you're in the shower and it feels good on that body and you want that heat on there, heat may work better for you than ice would be with it. But for any intense flare-ups, sometimes ice is really nice to bring things back down, kind of numb it up a little bit. Usually each treatment should be about 20 minutes. One of the questions going into the class was ahead of time is how do you manage low back pain sitting at a desk all day? Other than doing some stretches and mitigating some of those changes that happen to when we become adapted to chair position, get up. 2 to 3 times an hour is the gold standard, even if you have to set a timer, even if it's for 30 seconds, even those little micro breaks can make a huge difference in the accumulation as to how much that this is going to impact you on the other side of it, or just decreasing that cycle of things just building. And move more. As human beings, we need to move more between just all the lovely other health benefits of reducing stress and anxiety, improving sleep. Being able to move, though, helps lubricate all the joints, helps keep things moving better for just your digestion and the immunity. If you can't do that, that's usually when you need some help. That's the time. It's the time you need to see a specialist. You might be doing a lot of the right things. But if you're still running into those roadblocks, guys, that's usually when you need to go get some help from a specialist with that. 2 more tips. Whoever's on here still, you're awesome. Can't see you in the videos here, but for everyone who's here at the start of this, you guys are awesome. You got this. A couple of quick patient stories at the end of patients who've worked here with us. This was a 68-year-old retired grandmother, had back, hip, and knee pain, and some foot pain as well, but the back was the worst of all. She watched her grandkids 2 days a week. She had a 10-month-old and a 3-year-old. She liked gardening, biking, hiking, traveling, but she had issues with the back pain with a lot of those activities, standing, sitting, sleeping, and lifting the heavy grandchildren. She had a bike ride that laid her up for 5 days and then went for 2 rounds of spinal injections and had 1 week of relief for each one, and then all the pain returned. Tried a few different things, acupuncture and massage, got some temporary relief. All the pain returned. We talked about a couple key quick wins in terms of resetting the foundation, resetting the core. She did have some other things with her foot, so we had addressed an old ankle injury. 6 months later, though, all these areas, she's doing fantastic. I could say longer than 6 months now since the last time the slide was made, but she's a big traveler. She still is lifting the grandkids. She still is biking and hiking. Does have some arthritis in the knee. Sometimes we can make some impact with it, but sometimes arthritis is going to be something that's still there, but you can still have some extra relief with it. But it's always being honest with those situations. And here's another one. 44-year-old teacher, extreme back pain for 4 months with sciatica, couldn't stand for more than 5 minutes without dragging his leg behind him. Golfer, softball player, hiker, and musician. This is insane. Like 18 traditional PT sessions, 10 plus chiropractic sessions, 2 MRIs, 3 rounds of spinal injections, had 0 relief, and was told at age 44 you need a spinal fusion. Within 3 sessions, this guy was so out of alignment, his back pain was 90% better in just like 2 or 3 sessions. Working on retraining his core. This is probably almost like 3 years later now, and I still have a follow-up with him from time to time, just checking in with him. Still plays softball, still plays in his adult softball league, still golfs, no pain with daily movement, no surgery. So just a couple of our Google reviews. This is people who struggle with low back pain for years, finding relief almost immediately through myofascial release techniques. One-on-one care is incredibly helpful, and also with the tools that we help teach you guys at home. This was a retired chiropractor who was going only the chiropractic route of just getting adjustments over and over again. Things could still be great with adjustments, but this was a retired chiropractor who just was at his wit's end. And we worked on a lot of these things that we were just going through these slides here. And he says, fortunately he found me, and he was a great guy, able to solve longstanding back problems. So, and then just another one right here. This is one of the things we talked about, tools for life, guys. I love this review at the end. This person who says, maybe I might be 99% pain-free on my days. Never had the injection. If the disc flares up, which is rare, but I know what to do to calm it back down. That's what we want, guys. We want you to be able to take care of yourself. We want to be able to have you with a skill set and a toolkit that helps you take care of this for life. Reminder, the raffle's coming in soon. So, or it's going to come in. So whoever's still here, type I'm still here in the chat. Then we'll take down your name. And again, a winner is going to be emailed tomorrow. So thank you guys for sticking around to the end. A lot of great information in here. I hope you found this valuable. Working with us. Anyone who's curious about working with us, I know some of you guys already have. We do 55-minute one-on-one sessions. Again, a full body assessment and evaluation to look where the quick wins are. Always learning where your goals are. We always want to direct your plan of care towards your goals rather than just saying we're just going to just give you these exercises. We always want to make sure you're getting towards your goals. Specialized hands-on care, looking at those quick wins, whether it be myofascial release or soft tissue work, cupping, dry needling, etc. Tailored home program for your body. Again, going after your specific imbalances so you know how to take care of your body's problems. Not everyone's back pain is always going to be the same. There's some usual suspects, but it's not always the same. And you are learning tools for life to help keep you feeling better and living your best life. Some of you guys have already taken the steps to work with us. If anyone is still on the fence, you can put in the chat. These are the options in terms of if someone says I'm ready, like they're ready to start just getting to the root cause of the back pain. They want to start getting some better control of their health once the hands-on treatments, customized exercises for their specifically for their body. They're ready to start now. Great. Some people, it's okay. They're not ready for that yet, and they just want a few more questions. So you just have questions. Come in for a free discovery visit. We'll sit down and chat for about 20, 30 minutes, just give you some clarity as to what you got going on, what we're seeing, what some of those next steps would look like for you, and just to see if it's the right step. As I said earlier before, if we're not the right fit for you guys, it's okay. Like, we just want to make sure that you are getting help with this and you're finding clarity as to where you need to go with this. There's really no pressure with this. And then not quite ready. It's just, I'm not quite ready for a visit yet. I just want to keep researching and trying things on my own for now. And that's okay. We got more information available. You can always go to the website. We have a number of free downloadable guides. We have our YouTube channel. We have our Instagram. Still going to continue to build those out, but the guides will be also a fantastic place to start as well for some more information if this still has not satisfied some of your needs for more information. And for all of you who stuck around to the end, thank you guys. Thank you. Let's see here. Whoop. And then we're going to stop the recording here. Just give me a second here.